Well, our next topic is something that many people can actually benefit from. How to save money on prescription medications.
Sometimes it feels like you never know what to expect when you pick up your prescriptions. Is it going to be expensive or affordable? We're here to break it all down for us. We have Dr. Manavjeet Sidhu from the Department of Emergency Medicine at UCSF Fresno. Welcome so much to the program, Doctor. Great to see you.
Thank you so much for having me on the show. Like you said, I'm going to be talking about ways in which we can all save money on prescription medications.
Well, you're definitely the expert on this, so we're so happy to have you here. First of all, why does it seem like when you go to pick up your prescriptions, you never know what you're going to get?
Well, part of it has to do with when doctors prescribe you medications, they themselves don't know the cost of that medication. There are websites out there, which I'll be discussing, which can kind of help elucidate some of those costs, but we ourselves don't know, and then the patient doesn't know either. So when they go to the pharmacy, they try to fill it up, they get that sticker shock, and then most of us, actually 1 in 7 of us, don't actually pick up our prescription medications.
Well, and we'll get to that in just a second, but I've got to ask, aren't most medications covered by insurance? So for those of us that do have insurance or are lucky enough to have insurance, why should this be a concern?
Yeah, so most of us do have insurance, but in some cases, the insurance company doesn't cover necessarily the entire cost of the medication. Using some of the tips that I'll be discussing, there are actually ways that you can pay less out of pocket than even what the deductible would be from the insurance company.
So cool. Well, let's get to the tips right away.
Okay.
Since you've been, very experienced in this field, you're going to help our viewers so much. So let's talk saving money here.
All right. So the very first tip is shop around. So shopping around is good for a lot of things. It's not just good for big purchases, but also prescription medications as a whole. There's a huge variability in cost when it comes to prescription medications, even within the same zip code. So I'll give you a story. I had a patient, he was on a blood pressure medication simply because he had had a heart attack 1 year prior. So he was supposed to take this medication every day. He did that for several months, but then stopped when the price of that medication went from $20 a month to $140 a month.
Whoa.
Now, that 7-fold increase, that happened all of a sudden, and he didn't get any kind of notification prior to it happening. He called the insurance company. They basically said they no longer covered this medication. While in the emergency department, one of our case managers, these guys are like miracle workers, were able to actually find this medication for $15 a month for him.
Wow. So they shopped around
They shopped around, exactly.
So where do we shop around? Just online or at other pharmacies?
Yes. So one of the things you can do is just simply go into the pharmacy. You can call them and say, hey, what would be the out-of-pocket cost for this prescription medication?
Got it.
And then we don't want to forget about the savings programs. Tell us what those are.
Sure. So there's quite a few savings programs that are out there, but overall, a lot of the big chain pharmacies have their own programs. But the two things to really factor in is, one, does the savings program actually cover the medication that you want? And number two, some of these programs have their own yearly fee, a monthly fee, which may make it at the end of the day less of a ideal deal. And you may be paying more.
So look closely.
Exactly.
At those programs.
Pay attention. Okay, so I heard that you did your own research kind of as a secret shopper.
Yes. Okay. I definitely did. I did kind of what the case manager at our ED did. I called a bunch of different pharmacies in the area, and I wanted to look up what would be the highest price and what would be the lowest price for a medication that is used quite widely. It's called generic Lipitor, also known as atorvastatin. It's used to treat high cholesterol, and surprisingly, the highest price that I was able to find was $157, and that's for a 30-day supply. Now, the amazing part is that the lowest price that I was able to find was $10.11. Same medication, same dosage, and same 30-day supply.
Interesting.
But where? So the 157, could you tell us where the 157 was and where the $10?
Yeah, so the 157 one was a big chain pharmacy.
Gotcha.
And the pharmacy that was lower was actually a small
little mom and pop shop.
Wow.
Yeah, those still exist, believe it or not.
Wow, that's good to know.
Okay, the other option here, you mentioned this a little earlier, is online pharmacies.
Yes.
What are some of those, and how do we know if they're trustworthy?
Sure. So there are quite a few different online pharmacies that can be used. They've gained a lot of traction over the course of the last few years because A, they have low overhead cost, so they then transmit that cost down to you. Also, they're very convenient. They deliver the medication right to your doorstep.
Yeah.
But you're right, there are a lot of pharmacies out there that are kind of fraudulent. They don't actually deliver the medication to you. They just charge you and leave you high and dry. So one of the things you can do is there's actually, on the bottom of most trusted pharmacies,
there's the symbol.
the symbol, the VIPPS symbol, which basically indicates that the National Association of Boards of Pharmacy has actually vetted this website and that it's actually a genuine
Good to know.
online
That
pharmacy.
is really
Yeah.
good to know.
Because I feel like everything's going online, and soon enough, our pharmacies, and they're already starting. So it's good to know what you can trust.
Yeah, I'm imagining that soon we'll have mobile apps as well.
Yeah.
Yeah, definitely.
Definitely, yes.
Wow, well, such great information.
Yes. It's all about saving the patient money.
All about saving patient money at the
And
end of the day.
go ahead.
When in doubt, go to your doctor,
I was just gonna
ask them
say
what
that.
to do.
Yeah, exactly. So the other thing you could do is a lot of patients, they don't like discussing cost with doctors. But at the end of the day, we're here to help, and we can work on finding an alternative if the medication that you're currently prescribed is costing you a lot of money.
That's great. So
Very
don't be
helpful.
embarrassed or afraid to talk to your doctor. Communitymedical.org is where you can get more information. And if people want more information on what you do and where you're at, doctor, where can they go for that?
So what they can do is they can go to the website for our hospital.
Okay.
They can also go to UCSF Fresno main website, and we can
Gotcha.
have some links there as well.
Thank
Dr.
you.
Sidhu.
Thanks so much. Thanks for saving us
Thank
money
you.
on
Appreciate it.
prescriptions.
Thank you for having me.
Appreciate it. Come back soon.